Hey everybody, it is the Austin Travis County EMS System Office of the Medical Director official podcast. I'm your host, Dr. J.R. Pickett, and of course, we're not the OMD anymore. We are now the Office of the Chief Medical Officer, or OCMO. In fact, we are the City of Austin Office of the Chief Medical Officer, or COCOMO. At least that's how I'm going to be calling it for the rest of my life.
Off the Florida Keys, there's a place called Kokomo.
So I'm doing a short one today regarding our new masking guidance. If you work for the City of Austin, you saw the city manager's email today saying that we are no longer requiring employees or visitors to wear masks in City of Austin buildings. That is with a few exceptions, and we'll get into those in a little bit. So that's really good news. I think that is a sign that we have done such a great job as a community in coming together to help fight this virus with the various measures that we've taken, the masking, the social distancing, and getting vaccinated. So all of this has helped to really slow the spread of infection, this horrible disease that has killed more than 500,000 Americans already. So this is, I think, a sign of hope, a glimmer of hope here that we're doing better. And so I want to talk a little bit about what our current rules are and what the reasoning is behind those various rules. Number one, I want to talk about our layers of protection. So layers of protection against this virus, number one is vaccination. That's the most effective. It is extremely effective. It's shown to be effective against many of the variants that are out there, and it is probably the best thing that you can do to protect yourself, your loved ones, your community from this virus is to get vaccinated. And now the vaccines are widely available to everybody. They're available for ages 12 and up, and it's really there's no reason now not to get it. We can get it, and so please do. Number two are the protections, those measures that you take to help prevent the spread. This is the masking. This is the social distancing, the use of hand sanitizer, and limiting travel and so forth that we've been doing to this point. These are measures that help to prevent you from coming into contact with the virus. Third is what our community has done overall and the prevalence of the virus within our community, which, like I say, has dropped significantly, and that's really great news. So again, preventing you from coming into contact with the virus in the first place. So let's get into our masking guidance. Number one, first and foremost, patient care, wearing N95s or P100s. The reason for this is I talked about, like, not running into the virus. If you're doing patient care, you have a 100% chance of encountering this virus again. It's just a fact. It's out there. We are medical providers. We're going to be taking care of people who have this virus, whether we know it or not. And what we've found through this multi-month, over a year now of fighting this, is that COVID-19 is tricky, and we know how many of our patients do not have classic symptoms, and we find out later, we get that phone call from the hospital or from our safety folks, and they say, oh, hey, that patient that you took care of, by the way, they had COVID, and we didn't know it. So by being consistent with the N95s and 100s, then we don't have those questions. We did have a lot of cases where folks started a call with a certain level of protection, like a surgical mask, and then the call ended up progressing and they ended up doing aerosolizing procedures and not upgrading their PPE like they should. By starting out just N95s or P100s for everybody, then we don't have that issue occurring. The other problem was that when we put out the first set of guidance on PPE, utilizing N95s and surgical masks and all of this stuff, we found that they were much more confusing. The people had trouble following them. They weren't sure, like, what is the situation in which I have to use the surgical mask versus the N95? And we had a lot of exposures that were probably unnecessary because folks didn't fully understand that guidance. Once we went to N95s for everything and for everybody, then there was a lot less deviation from those guidelines, a lot less exposures. So we're going to continue with those N95s and those P100s. Of course, everybody's been issued a P100 mask now, so you can wear either one of those. Now, what about in the stations? This is where that new masking guidance comes in. Now, we've done a pretty good job of vaccinating our folks at EMS and at fire. So we now have 86% of EMS that's vaccinated, vaccinated. We've got around 70% or so of our firefighters vaccinated. So we're seeing that most of the people that you work with are vaccinated and they have that protection. So in the station, you do not need to wear a mask if you choose not to. If you choose to, that's fine. That is absolutely your right. If you have extra measures of protection you want to take, especially if you're not vaccinated or you have a medical condition that puts you at high risk for serious complications, or you have a loved one at home that has a medical condition that puts you at high risk, you want to wear a mask, that's fine. That's okay. But it is not required, whether you're vaccinated or unvaccinated, to wear a mask in the station. Now, somebody said, "Well, wait. If they're unvaccinated, then they could be vulnerable." Yes, they could be, and they are. However, with the vaccination rate that we have within our workforce, we think it's unlikely that you're going to run into that in the station. And the guidance from our health authority and from the CDC is that outside of your home, then if you're out in the public and you're unvaccinated, you should be wearing masks. But nobody recommends that in the home. And these stations are our homes. We live there, we sleep there, we eat there, and we're in a small cohort of people. So we don't feel that we have to wear our masks all the time while we're in the station or while we are in the apparatus traveling with other people. So what about going out in the public? So when our firefighters have to go to the store to buy the food for the 7-course meal that they're going to cook on shift, or the medics have to go to the convenience store to grab a Marie Callender frozen dinner and hopefully microwave it and wolf it down before the next call comes, then should we be wearing masks when we're out and about in the public? So again, if you choose to do so, it is absolutely your right to do that, and we encourage you to do that. However, if you are fully vaccinated, then you don't have to do that absent other restrictions. So you don't have to be masked when you're out in the public if you are fully vaccinated. If you're unvaccinated, it's still recommended that you wear a mask while you are out there. So if you're unvaccinated, please wear a mask when you're out in public. The other thing is that a lot of store owners, a lot of businesses, they still want their customers and their employees to wear masks. They want to have that additional layer of protection, and it's their right to ask people to do that who are customers in their stores. So we go into somebody's store and they ask us to wear a mask. You know what? It's your house. I'm going to wear a mask. Okay? I have no problem with that. I'm going to follow those rules that you've placed for your place of business. So do we have to, however, if we're fully vaccinated? No, and that's because you do have that very good layer of protection of the vaccine. So we realize that what is right for our community is not necessarily right for other communities. And this guidance is based on what we are seeing here locally in Austin and Travis County. That is based on the prevalence of this disease within our community, based on the actions that people are taking and seeing the spread of this virus through the community. And that's why we have come out with this guidance. We realize that what is right for Austin is not necessarily right for Salado, and what's right for El Paso isn't necessarily right for Austin, and that's okay. So that's why these recommendations are done locally. Now, there are exceptions. So if you are going into a congregate living setting, a nursing home, a jail, a prison, a group home, anything like that, then you do need to be wearing masks in those settings, and those settings are going to ask that you wear them anyway. So like we talked about before, you go into a facility that they are requesting you to mask, then you're going to go ahead and mask. So those congregate living settings, then we want to do that. Healthcare facilities, also you need to be wearing a mask. Now, presumably, if you're entering a healthcare facility, you're doing patient care anyway, and so you're going to be masked regardless, so you're going to do it then as well. Bottom line is, there are some who are going to want to take additional precautions. Folks who are unwilling or unable to get vaccinated, or they have medical conditions that put them at high risk of serious complications, or they have somebody at home that they're trying to protect who has a medical condition that places them at risk of serious complications, and they may wish to wear a mask at work. They may want to have that additional layer of protection even if they're vaccinated, and that's fine. We respect that. Now, there are some that will want to take additional precautions, that are going to want to wear a mask when they're in station or when they're out in the public, and that's whether or not they've been vaccinated. Maybe they weren't able to get vaccinated, or they are immunosuppressed, and so they can't depend on a robust reaction and creation of immunity from the vaccine, or they have medical conditions that place them at high risk of serious complications, or they have a loved one at home that they're trying to protect that has medical conditions that put them at high risk for complications. If they want to wear a mask while they're at work, while they're in station, while they're out in the public, that is your right to do so, and nobody's going to stop you. Please, we encourage you to do that. Now, the comfort that people have with various protective measures, such as masking or unmasking, is going to vary greatly from person to person. Be gracious, be respectful of those desires, and please just don't be a jerk. So that's all I've got. Thank you all very much for listening. I appreciate it, and I will see you out there.